as equitable as I would like. And we are working hard to close the vaccine gaps that exist amongst our communities of color. And we've made good progress in the last 4 weeks. However, we still have a lot of vulnerable Oregonians that haven't gotten a vaccine yet. And as you are well aware, Oregon has the fastest growing infection rate in the entire country. We're focused on saving lives and want to make sure that Oregonians have an ample opportunity to get vaccines. This is truly a race between variants, the vaccines. As Dr. Graben said, we need a couple more weeks, 3 to 4 weeks, to get more vaccines into arms. That's where I'm focused. There are a number of ways that Oregonians can support their favorite businesses. They can continue to do takeout. There is the option of eating outdoors, and of course, continue to shop and purchase items online. So I want to encourage Oregonians to support their local businesses. I'm doing everything I can to get economic relief out the door as quickly as possible. We want to ensure that these businesses survive and thrive. They're essential to our economy. But right now, I am gravely concerned about vulnerable Oregonians, about our hospital bed capacity, and the ability of our healthcare workers to provide medical care.
All right, I'll let other reporters ask questions. Thank you.
Thank you, Pat. We'll go next to Aaron Ross with OPB. Go ahead, Aaron.
Hi, so quickly for Dr. Graben, just to confirm that I have this correct, that's 176, the model is predicting 176 extra deaths by through the end of summer if we were not to implement any changes right now.
That's correct. But I will say it's primarily in this next month. I tabulated it up for the whole summer, but it's essentially most of the difference between the two policy passes is just in the next 4 to 5 weeks. So they would be concentrated in that period of time.
Thank you. And Governor Brown, given both the data in Oregon and from around the world that's showing that we can't necessarily just put the increase in infections in young people on vaccinations alone, that they're also getting significantly sicker. How is that going to change or alter your in-person education plans, or do you have any changes that you're planning on making?
We are not planning on making any changes at this point in time in terms of our education plans. Schools have been doing a really terrific job around the state, complying with Ready Schools, Safe Learners. What we know now is that the risk of transmission is low if folks follow these safety protocols, and it's critically important for our kids to be back in the classroom, learning from their teacher and their peers. It's really good for their education, it's good for their mental and behavioral health, and good for their social development.
What we have seen, though, with B117 is that it is both significantly more transmissible, so it takes less of the virus to get you sick, which means that you have a better chance of getting sick if you're only barely exposed, but also that it does appear to be significantly more severe, and severe across all age ranges. So does that raise concerns for you?
Certainly, I'm concerned particularly about the transmissibility of the virus. I'll let Dr. Seidlinger speak to the severity of the variants. But again, I would say this, the best way for folks 16 and over to protect yourselves are to get vaccinated. It's the best way to protect your loved ones, your family members, and our vulnerable community members. It also helps us prevent hospitalizations and deaths. So please, if you haven't gotten vaccinated, please do so. There are a number of resources available. And with that, I'll turn it over to Dr. Seidlinger to talk about the severity of the variants.
Thank you, Governor Brown. Thank you, Aaron, for that question. I think with Ready School Safe Learners, we have multiple safety measures in place to protect that teachers and the families they return to. We have physical distancing, 3 feet within classrooms under certain situations, and 6 feet in other settings, and hand cleaning in those settings, especially high touch surfaces.
Wait, he said 6 feet. They changed it to 3 feet in schools. I'm rewinding that part, and he's hard to hear.
The severity of the variance.
Thank you, Dr. Brown. Thank you, Aaron, for that question. I think with many schools and partners, we have multiple safety measures in place to protect students, and teachers and the families they return to. We have physical distancing, 3 feet within classrooms under certain situations, and 6 feet in others.
Okay, he did say 3 feet in some.
In those settings, especially high touch surfaces, availability of hand sanitizer and to wash your hands. Using masks in those settings and symptom check and other ways to work to spread disease within the setting. We offered on-site testing to schools so they can test individuals who become sick at school or exposed at school. We've got 12 schools already signed up for that program. In addition, the adults in the setting, the educators, have been offered vaccines and have taken a thought on getting vaccinated. And 16 and 17-year-olds in the setting are now eligible, and we hope soon 12 to 16-year-olds. All of those things will do incredible work against preventing the spread of COVID-19 within those settings, including the more transmissible variants like B.1.1.7. While we have seeing more cases associated with schools since
Hello.
opened up and COVID rates have gone up, we still see very limited evidence of transmission within schools in those controlled settings with multiple safety measures in place. I ask teachers and staff in those settings, parents and kids in those settings, to think about the activities they take part in outside of their social activities and extracurricular activities and do them in the safest way possible, because we typically see spread happening in the community that's brought to the school, not spread happening within the school and brought out to the community. Those safety measures protect against B.1.1.7 and other variants, and getting a vaccine protects against all those variants as well. So for students and staff in those settings, they should be getting vaccine when they're eligible.
Thank you, Dean.
Thanks, Aaron. We'll go next to Gary Warner with EO Media. Go ahead, Gary.
Hi, Governor. I wanted to find out how you're going to deal with the people who are belligerent against vaccination. An incident yesterday out in Bend where there was a high school vaccination event and anti-vaxxers showed up and were heckling the kids, calling them Nazis, calling the people who were giving the shots Nazis. There are going to be more of these events coming up pretty soon. Can these people be stopped somehow as obstructing a public health emergency? What are you going to do on those who are unfortunately out there who want to not just be hesitant about themselves getting it, don't want anybody else to get it?
Hello.
I've spent my entire public service career working to engage Oregonians in the public process. I'm not going to change that stance now just because I might disagree with the message of the messenger. I think what I would say to them, what I would say to all Oregonians is that while I'm governor, I hope in the future we're going to continue to rely on science and data in making public health decisions. And I would encourage Oregonians, if they have concerns or questions, to reach out to their healthcare provider to get the information. I'm pleased to hear that there are such broad spread efforts working to get our high schoolers vaccinated. I think they understand, their parents understand, this is how we protect kids from this virus. This is how we protect adults, family members. And then Gary, lastly, I would just ask that those of you in the media continue to share the story of young people like Mariana. Her story is extremely scary, and I think parents, students across the state need to hear it. But we're going to continue to make health policy based on science and data.
Based on the emergency declaration, is there anything more you can do against people who are obstructing vaccination centers?
We will certainly look at what tools that we have. To my knowledge, there are prohibitions on folks blocking access to healthcare clinics. But as you are well aware, Oregon, along with 47 other states and the District of Columbia, continue to have emergency orders in place. I expect Oregonians to comply with these orders.
Which two
Thanks,
don't?
Gary. We'll go next to Amy Green with the Oregonian. And Amy.
Question is for the governor. Oregon is a bit of an anomaly nationally, with only a handful of states increasing cases. None, as you said, more fast than more quickly than in Oregon. OPB asked OHA Director Patrick Allen on the air this week, couldn't you see this coming? Cases have been rising for 5 weeks, and I was a bit surprised to hear his answer.
Wait, I'm
Because
this is
of
from,
COVID.
I'm rewinding 20 seconds
As
because
you
I didn't
said, more
hear
fast.
what she said.
Question is for the governor. Oregon is a bit of an anomaly nationally, with only a handful of states with increasing cases, and none, as you said, more fast than more quickly than in Oregon. OPB asked OHA Director Patrick Allen on the air this week, couldn't you see this coming? Cases have been rising for 5 weeks, and I was a bit surprised to hear his answer. He said essentially, because of COVID fatigue and public resistance to more restrictions, it was necessary to let hospitalizations rise to a certain point before enacting actual restrictions in order to get public buy-in. The question for you, Governor, is do you agree with that? Can you speak to why you waited so long to enact these restrictions when cases have tripled in the past 5 weeks?
I've been talking to Oregonians every single week, expressing concerns about the growing numbers of cases, and been very, very clear. Should folks, all of us, not take the actions we need to reduce the spread of the virus, then we would be taking more restrictive action. Put the metrics in place based on data and science. We're following those metrics. And, I think you have to have some level of public support for these to be successful. What I think is really, really important is that Oregonians be able to get the medical care that they need, regardless of where they live, whether they have a very severe medical event or have an unfortunate accident. I'm absolutely committed to making sure that Oregonians get the medical care that they need.
No, respectfully, I don't think that really answers the question. Why didn't you enact restrictions weeks ago? We know
She just
COVID
said why.
cases and hospitalizations they can grow exponentially. You could have potentially stemmed the extent of this latest surge. Were you worried about people not buying in and following the restrictions?
This is always a balance between lives and livelihoods. I think data shows that Oregon has reached the right balance. And what is different now is that we have the variants in place, and we have vaccines. So it is more challenging, frankly, for Oregonians to understand why safety protocols need to be in place. The pandemic has forced upon us when there are vaccines, and we have the variants that are moving, frankly, at a much more rapid pace. Dr. Seidlinger, would you like to fill in here, please?
I think the balance we've had in fighting this disease has really, it's not policy that drives the change, it's policy with people following that policy. After more than a year of fighting COVID, we know that everyone is tired. We know that people want to go back to eat. We need to grieve with their families over the loss of loved ones over the last year. We need to celebrate the milestone. And so we've been talking about the increased cases and asking people to change their behavior. People have, the vast majority of Oregonians are doing what they can to protect themselves and their loved ones. So over these next few weeks, we need more Oregonians to join us. We need more Oregonians to make their point to get their vaccine. And doing that, we will see cases go back down. We will see hospitalizations go back down. And we will once again be a leader in fighting COVID here in Oregon. Over time, the numbers are so compared to other states. And we need to get our recent numbers back down. We'd like to be known for successfully fighting this disease and not the state that's most impacted by this disease. And together we can do that.
Thank you.
We'll go next. We have time for one last question, so we'll go next to Ben Botkin with the Lund Report.
We can do that in other states. And we need to get our recent numbers back down. We'd like to be known for successfully fighting this disease and not the state that's most impacted by this disease. And together we can do that.
Thank you.
Thank you.
We'll go next. We have time for one last question, so we'll go next to Ben Botkin with the Lund Report. Right, Ben.
Yes, I was hoping either Governor Brown or Dr. Seidling, if you could explain what exactly the percentage is that you use to decide when the majority of Oregonians have been vaccinated. Can you give me a specific percentage?
Thank you, Ben. The answer is no. What I've said is that we need to see a solid majority of Oregonians vaccinated. That includes our communities of color, Latino, Latina, Latinx population, or African American population, our Native American and tribal people, our Asian and Pacific Islander people. That includes all of these populations that are a critical part of our communities. Dr. Seidlinger.
Thank you, Governor Brown. I think that the answer to that question is, as Governor Brown said, is no, we can't tell you a certain number. With this being a new disease, we make some projections that 70 to 85% of people would need to be vaccinated. Every person who gets vaccinated, and every percentage we decrease the percentage of Oregonians who are vaccinated, helps us drive down cases as we get towards vaccinating as many people in Oregon as we can. Having the vaccine available to all Oregonians over 16, and hopefully soon having it available to those 12 and older, will help us achieve that. But we need everyone to come together. As Governor Brown stated earlier, you've gotten your vaccine, help your neighbors, and help your friends get the vaccine. If you have questions about the vaccine, go online to trusted sources, the Centers for Disease Control and Prevention, Oregon Health Authority, a trusted community partner. Call your healthcare provider to talk about the vaccine. Because these vaccines are safe and effective. The more people get vaccinated, percentage by percentage, person by person, get closer to winning the fight against COVID, going back to doing the activities we enjoyed before COVID came, and having COVID be a distant memory.
Thank you, Ben. Governor, that's all the time we have for questions today.
Thank you all so much. Please stay safe out there and have a good weekend.
Okay, I want to say something. I have a vaccine appointment that I canceled at 2:45 today because OHS, who was scheduling second doses of Pfizer at 4 weeks when the CDC recommended is 3 weeks. And it was hard. It was hard, as in checking every day at 4 in the morning. But I got an appointment last Friday, so I already got my second dose at a Walgreens. And you're supposed to avoid NSAIDs, Aleve, ibuprofen, and also Tylenol, which is not an NSAID, like right before your vaccine and for 3, 6, or more days after, because it can interfere with the antibodies building properly. Also, I've learned that stress can interfere with antibodies building properly. When I had an emergency the other day, I had to remind myself that I needed to calm down once I addressed it, so that I don't want my antibodies to not build properly, so that I don't have as many as possible. So, and I did get migraine trigger last Saturday, maybe from the rain. I did take Claritin and Sudafed, and I did not take Aleve, which I would have normally taken. And I was miserable all day, and I rode 2.1 miles on my recumbent bike to try and get my circulation moving, things through my system. My temperature went up to 99.8, and it went up to 99.7 the next day. And I had a stomach issue, a small stomach issue on Saturday, but I did not get sick during the Academy Awards, which is one thing I was worried about by getting the vaccine on the proper date. So I am going to check really quickly before I end this broadcast. I'm wondering if I made a mistake and took a dose of Aleve the other day, and I'm going to look it up because today will be day 7. In a few hours, it will be the end. You're fully vaccinated 2 weeks after the vaccine. I'm just going to do a search for Aleve and see if I accidentally took it this week. I certainly did not take it last Saturday or Sunday. Let me look. April 15th, 22nd. We're looking after the 23rd on Wednesday. It looks like I made a mistake and took a dose of Aleve at 1:27 in the morning. And I must have not, like, that was, it says, what was the issue? I was dizzy, and the reason was dizzy, and I took, it has an X next to the Claritin. It says migraine trigger. I had a migraine trigger. I took 5 sips of coffee. I took a dose of the Aleve. I forgot. I was trying not to take any NSAIDs for at least a week past the vaccine. Beating myself up because I just realized I made a mistake is not going to help. If you take NSAIDs on a daily basis that your doctor told you to take, say to keep taking them. But otherwise, it is best to avoid Aleve, ibuprofen, or Tylenol if at all possible. And if you have to take something, Tylenol is safer in this case. So yeah, I apparently made a mistake on Wednesday, which was at 1:27 a.m. Thursday. So it was on day 6. I'm gonna make a note. I made a mistake. All right, I'm gonna watch DBL. If anyone has any comments or questions, they can type them in the chat if they're on HAPS. If you want to follow me on HAPS, it's haps.tv/invite/@ symbol Harbor Journal and the number 2. If you have any comments for me elsewhere, you can direct message me on Twitter or on Facebook or type in the chat. And if you want a free code for PodFest Global next week and the week after, the code is Harbor. I'm going to put up on my social media information later with the link for the Eventbrite register. Okay? All right. Thanks for listening, to the viewers and the replay viewers. And hope you're able to hear Governor Brown and the questions because I wasn't able to check the sound on that. All right, I'm going to end this broadcast now and have a good day. Stay safe out there. Wear a mask, and unless you have a reason not to get vaccinated, it really is your best bet because in a week, less than 2 hours, my risk will drop from being high risk less than half of 1%. There are still breakthrough cases. There are still 3 people that died in Oregon. 0.5% is a much better risk than the category that I'm still in now. And I am going to try and go outside today. Right. So I'm trying to be 1 to 2% better every day because when I try to do 100%, I just get nothing done because I overwhelmed. So 1 to 2% better yesterday. And I didn't get very much sleep because I was dealing with an emergency. I didn't get much done yesterday, but I'll try. It was because I was trying to get something done that I ended up having an emergency. I'm going to try and get something done today. So thank you for listening. And if you want to watch DBL, you can watch it on KGW. I thought it was only on from 2 to 2:30 and they only showed half of it. No, they actually show it in Oregon from 11 to noon and then they show half from 2 to 2:30. But you can watch the whole thing on Facebook or their YouTube channel, Valley Blast Live. So It's 2:04 and I have a call at 4, so I'm gonna end this so thank you for joining and have a nice day. And I did say if you have a reason to not get the vaccine, one of my family members may be a COVID vaccine denier, but I also told her not to get the vaccine because she had an allergic reaction to another vaccine. But I did tell her, their family member, to get the vaccine. So, yes, and I did say last Saturday that I felt like I was going to die. And someone said, well, you say I feel like I'm going to die in relation to a vaccine. People are going to, I said, no, I'm being dramatic. I had a migraine trigger. I didn't take a leave because I wanted my antibodies to pill properly. I felt like crap all day and avoided taking a leave. And I felt really bad. I didn't really think I was going to die, or I would have called 911. So this isn't about the vaccine. I think that the vaccines are safe, and that the fact that I had a reaction and got a temperature means that it's working. If you're older and you don't get a reaction, it doesn't mean it's not working. There's some people that vaccine, they still don't build antibodies for some reason. They have so I'm okay with the fact that I knew I wasn't sick. If I had gotten a migraine trigger that caused an aura where it affected my vision, then I might have made a different choice, but it never got to that point. So I was miserable all day. But yeah, because my first layer of defense against a migraine is my migraine glasses, Aleve, Claritin, and Sudafed. And they're sinus triggered and the tree pollen is high, and I did not take the Aleve that day. Although apparently at 1 in the morning, I forgot my medical advice, and on day 6 did take a dose of Aleve, and I'm repeating myself now. So have a nice day. Bye. Thanks for tuning in.